Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and we are going to be talking with Jon Elwell, CEO of Know2, and Teresa Bell, President, Co-founder, and CTO at Know2. We're going to talk a little bit about interoperability, the current state of things, and we're going to dive into a very interesting blog post that you guys posted with a very provocative title. I can't wait to get into that with you. Now, Know2 is a company that we've been following for a little bit. You guys are kind of on the leading edge of communications for the healthcare industry, and you've recently applied for the QHIN status. So we're definitely going to dive into that. Welcome to the program.
Thank you. Welcome to be here.
Yeah, thank you, Colin.
Teresa, maybe we'll start with you. If you can maybe talk to us and give our audience a little preview of what Know2 is and what you do.
Yeah, Know2 serves as the largest network aggregator in healthcare, and that's a mouthful to say it for sure. But we, through a single API, when we started the company, attempted to solve what has only increasingly become a challenge in healthcare, and that's connecting all the different ways in which patient information from fully unstructured to fully structured can be shared and making it available through one API. So we're an API company providing communication across the healthcare ecosystem.
And who are your customers?
We are a channel company, so largely we go through partners, and our partners are wide and varied. So obviously EHR partners, we've targeted many of the overlooked markets in healthcare. So you look around the health system, where we always say where money was always flowing in meaningful use, people went after the health systems and the providers that were on some of the mainstream EHRs. We went after healthcare that was in the post-acute area, behavioral, dental, vision, EMS. But our partners since then have really taken off. So we've got digital health platforms, we've got telehealth platforms, we have remote patient monitoring. We really don't discriminate, quite honestly. All of them are eligible to use the communication API from Know2.
Now, you recently posted a pretty provocative titled article. It was called "Healthcare Will Not Survive Without Better Communication." Jon, I got to ask you about that. What inspired that kind of a statement?
I'm happy you said it was provocative, by the way, because it was intentional. Meaning, as you know, in what you participate in, there's a lot of communication about topics in healthcare all the time, and they tend to fall in the same routine. So we were attempting to get outside that tailwind and kind of make a broad statement based upon our activity in the market, both with our partners and their customers, that healthcare today is in a pretty tough spot, right? I mean, I think we all know that. I think we're all reading what's happening, whether it be staffing shortages, the impact of the pandemic, costs overall, reimbursement pressure. The industry overall is in quite a bit of stress. And it wasn't intended to say healthcare doesn't exist. So when I say survive, it didn't mean it didn't exist. What it was intended to do is, one, to capture your attention, then more importantly, to point out that what we're used to in our healthcare system is what we want to persist. Right? Meaning we'd like access to our providers in a matter of days, not weeks or months. We'd like to be able to go to the hospital in emergency or otherwise and know that there's a bed for us. I think that we've read recently that people are in waiting rooms in the ER being treated because there's no space for them. So there's a lot of stress in the system. And so the reason it was written that way was to get the attention of the reader to say, hey, do we want this to occur? Do we really want these outcomes to occur? And if not, what are we going to do about it? And I think as much as the industry's following the trajectory of interoperability, though it's not been fully realized, it's going to be a necessity to replace some of the bodies that just aren't going to exist. I mean, we know we're going to have staffing shortages. It's a fact. So what are we going to do about that now? So that's why it was provocative. It was to get people's attention. Please read, understand the state of the industry, and then know with optimism that there's ways in which it's going to be addressed.
So the communication you're talking about in that piece was around the data communications, the interoperability communications between organizations and departments. Is that right?
Provider to provider, provider to patient, with the payer as well. All the constituents that are involved in taking out, manual processes that are just incredibly overburdened in the space today. And if there aren't people there to do them, then it slows down the system even more. So that's what it was pointed out. Any communication, provider to provider, is obviously critical. Provider to patient, and with the payer involved, they're feeling the pressure of interoperability as well. And some of the latest legislation, I think, that's placed that pressure on them.
Now, of course, we've been talking about interoperability for a decade now, right? Decade plus.
Feels longer than that, to be quite honest.
And we still haven't achieved it. No. We're not there at the promised land yet. In that piece, though, you talked about 2023 being a very critical year for interoperability. Why is that?
I think it's a critical year because people are making moves, providers, practices across the industry, what we're witnessing, is they're making the move not because of interoperability. They're not making the move because of legislation or an incentive or a penalty. People are moving because they have to. Back to my earlier statements about the challenges they're facing. We often, and I'm sure Trace will talk about this in a moment, we're not even hearing the word interoperability, which was great news. I actually put that in the blog post. People are talking about digital transformation. Now, in 2023, it's a little ironic. I mean, maybe 1995 we should have been hearing those things, but we're hearing them in 2023. But that's good news, meaning people are making changes for the right reasons to help their practice perform, not because somebody said I had to or I was going to get penalized, but to do it for the right reasons. And so 2023 is a critical year because there has to be material change. And it just happens after the pandemic and a series of things that have occurred, where this year just happens to be the epicenter of it. So I think the things that are happening are for all the right reasons, which I think is great news for the entire industry.
Teresa, what are your thoughts on that? Why is 2023 such a critical year for interoperability?
I think it's, as Jon mentioned, all the market forces are kind of forcing the hand, and I don't mean that in a negative way, but forcing the hand of the providers to evolve into the next level to meet the demands of healthcare, but also in a positive way. We've seen all these technologies be applied, as Jon mentioned, in other industries, and healthcare is ready for that. Healthcare is primed for that, and it's a provider-based decision. Again, it's not being forced upon them, but they're doing it to step up. And I recently put a LinkedIn post out there and was reflecting on it actually on a drive into work one day, and roughly around June of 2022, and certainly was on the minds of folks before, I received 3 calls in a week, and it was from large provider groups that sat across the care continuum, from their CEOs and CTOs and their strategy officers, and they're saying, Teresa, they all had kind of their personal transformation journey they wanted to go through to get to a digital, across the digital divide, and at the heart of it was data. They're looking at it today and saying, I'm bound, I can't move forward because I'm stuck in these manual workflows and I don't know what to do. I don't know how to get connected in a meaningful way to the healthcare ecosystem to create change. So there's so many different driving factors right now. It's undeniable. I keep saying to the team, it's palpable. You can feel it in the air. Where, as you mentioned, that interoperability has been the long-standing theme at HIMSS for how many years now? Probably 15. But we're ready to see it move to actually impactful outcomes to these provider groups.
It is nice to hear that you're observing that we're not being driven this time around by just legislation, like that it is an intrinsic, we need to do this, that's driving the industry forward. So that's encouraging to hear. I hope it does manifest the way you're putting forward in 2023. But we have been chipping away at interoperability over the last decade, albeit slower than we all want. Describe to me a little bit about why you believe that better communication is such a key part of us achieving interoperability.
Yeah, well, first I'll start with this can't be where things are differentiated. Meaning somebody providing healthcare services in the industry shouldn't be at a different level of communication than another. This is not an industry in which we want competition to be served because I have better tools or more information than somebody else. So let me start by saying there should be no differentiation in the capability of any provider's ability to communicate. And we should all have a lot of passion to make sure that gets leveled up everywhere. With your experience in the industry, that's pretty disparate. You go into a health system, they've got a lot of tools, a lot of capability, plenty of staff, where they may question that they almost have too much interoperability. I mean, too much data is coming in, and we're not quite sure how to handle the deluge of information, where you can go into another care setting, you can see quite a difference in their experience. So I think the first and most important thing we should be considering is that there's no differentiation in communication everywhere. Once that is solved, and once effective communication's everywhere, given the interdependency, right? A patient is always being cared for by multiple care providers, usually on different systems and different locations. So what becomes critically important then? Communication is the absolute necessity to care for that patient. There's no other answer to get that collective group. Care coordination, we like to talk about care coordination. Coordination is difficult without communication.
All right, I could buy into that. Now, I'm going to put No2 on the hot seat for a second because you're talking about.
Not the first time we put.
Oh, well, all right. Well, we didn't, and we're not talking physically. We didn't put warmers or anything in there. But as an organization, you are putting out there that 2023 is such a critical year, communication is so key. Is there anything that you're doing differently this year to kind of lead by example or lead in this space?
It's a fair pushback on us. I'd prefer that Tracy answer that question. She's leading this effort. But it's an absolute approach, meaning, hey, you guys talk a lot. Are you actually doing something about it? I appreciate that, and I'll let Tracy answer the question. I think it's really important.
Well, I'll back it up to, first of all, the leadership has always felt in the company that to truly bring, as Jon was mentioning, a level playing field to healthcare, that we had the technology, first of all, had to be simple and easy to use. Second, had to be the economics around the technology. It had to be affordable to the healthcare ecosystem. So whether it was a health system with a little bit deeper pockets, although that's not necessarily true right now, moving into some of the, a post-acute ownership group where you go into a therapist. We always talk about the therapist in the strip mall that is working part-time. They have the right to the patient's information. So our economics absolutely drive and start to dismantle the walls that have existed historically. But this year in particular, with the phone calls that took place, immediately turned around in the company and brought in one of our leaders to lead an initiative which we call our care plan journey. And there's very purposeful use of that word, care plan, but it's to help these organizations go through their digital transformation journey. And that journey is unique, but at the heart of every one of those digital transformation journeys is the need for data. So how do we get them connected to the ecosystem and drive it through and really see the impact of all the technology we've brought to market? Where I always say we're not a technology company to be a technology company, we're here to drive outcomes. And we're applying service to that, and we're building out a very strong tech-enabled service that allows provider groups across the healthcare ecosystem to start to meaningfully connect their organizations and drive change quickly and effectively.
Now, our audience wouldn't be happy with me if I didn't at least ask you one question about TEFCA. Jon, how is the QHIN application going, and can you give us an update on that?
Yeah, well, I think as everybody knows, that's a tightly controlled discussion, so I'll stay within those boundaries.
Okay.
The application process is going fantastic, and hopefully for everyone. I think everybody's aware that there were 6 initial applicants. We're allowed to say that we've applied, and we're able to say that they've accepted the application. There's also going to be an event here in mid-February, which I think the ONC will publicly announce those that have become the initial QHINs. To your point, it's a really important initiative for overall healthcare. There's a lot of attention being paid to it. I think it'll address a number of issues. But from a No2 perspective, as a company, I'm very proud of what the company's done. I think we've put an amazing foot forward in that effort, but it's not for us to judge, and so we sit here and wait. But I'm very hopeful that come middle of February, that we'll be joining others in the QN initiative and again starting to address some of these challenges that sit across the ecosystem.
We'll look forward to hearing hopefully some good news in February then as well.
So do we.
Trace, a final question for you. Where can people go to find more information about No2?
Well, certainly at the website, www.no2.com. But also, I'd encourage, as you go out to the website, you'll see a list of our growing partners. We have a wide set of partners, as mentioned before. Reach out to your partner, too, to understand more, because we're as good and we appear through all the technologies that our partners have integrated. So everything from an EHR vendor to, again, a digital health platform, or even a device, a Konica or Xerox device that has embedded our APIs within their device. That's the experience. That's what No2 is. It's really how it comes to life through our partners. So reach out to your partners, reach out to No2, and we'd be happy to help.
Amazing. Well, thank you so much for being on our program today, sharing the information that you did. Yeah. Thank you so much.
Yeah, thank you.
Hey, if you enjoyed this interview as much as I did, we'd love for you to rate, subscribe, and mash that like button wherever you're listening and watching this. Also, head on over to healthcareittoday.com where you can get the latest news and industry insights. I'm Colin Hung. Thanks for being here.